Hi guys, we're here. We're back again. DSM Live, going strong. I'm filling in for Jenny today because Jenny is our beautiful model for this ViPeel. We're here with Kelly. She's going to show us the ViPeel. Sure, you guys have heard a lot about the ViPeel. There's a lot out there in magazines. They're constantly winning awards. So we're really excited and happy to have this peel, and we've had it for a few years now. We use it a lot. It's one of our favorites, and it's a really good go-to for that quick turnover to get your holiday glow, right, Kelly?
Sure is. Yeah. It's also good for pretty much any skin type except for rosacea. Contraindications are pregnancy, obviously, somebody who's been on Accutane within the last 6 months, and Retinol within the last week. So you'd really have to stop like about a week before any actives to get this peel. It basically targets, we have a precision peel that targets melasma, pigment. We have an acne purified peel, targets acneic skin, some scarring. And then we have a basic VI peel that's just for more fine lines, wrinkles. With any of the peels, you're going to get results with one treatment. Some of them, like deeper melasma and pigment, it may take, usually we like to do it in multiple treatments.
For best results.
Nice.
Very nice. All right, so what are we doing for Jenny here?
I mean,
she's flawless.
She's beautiful.
Come on, ladies.
Well, what we're going to do for her today is a basic VI peel. Jenny is flawless. She does have some very fine lines. So it will help with the texture of her skin. She'll notice some improvement with one treatment on the little fine lines and such. And she's going to be overall just brightened and glowing after 7 days.
Nice.
Yeah.
I hope you don't have any parties coming up within the next 7 days.
Yeah,
I do not, but I do have one on the 15th.
Oh, perfect.
So.
Jenny will be fine by then. Downtime is usually anywhere from 5 to 7 days, and it's really not terrible. You don't get like really inflamed. The first day there's a little bit of redness for sure. The next day you can expect to kind of feel tight, dry, maybe if you smiled, some cracking. And then just really like a light fluffy peel all over that will last for 7 days. It's usually not terrible. Basically, you just want to stay away from using any actives, wear your sunblock, treat your skin very gently, and probably not wear makeup just because it accentuates the dryness a little bit, I've noticed.
Mm-hmm. So now after you do this, is there anything she goes home with, or is there something she should get?
She does, yeah. So post-treatment, what she's going to do, this peel itself is self-neutralizing, so right after the peel, it will stop working right away.
Mm-hmm.
4 hours later, Jenny's going to cleanse her skin with the VI Gentle Cleanser, or really any gentle cleanser. And then there is a peel pad that we're going to send her home with. We send her home with 3. So 4 hours later, she's going to use that peel pad, just kind of rub it all over her face, especially in the areas where she'd really like to encourage peeling. Mm-hmm. And that's going to encourage the peeling of her skin. Mm-hmm. Right before bedtime, what she's going to do is she's going to, cleanse again. She's going to use that second peel pad, kind of do the same thing all over. And then apply, any moisturizer as long as there's no actives in it. If she's a little bit itchy, we also send her home with, it's a hydrocortisone post-peel cream. So she can apply that so she's not itching, because it can be a little bit uncomfortable after, a little itchy for sure. Mm-hmm. And then the next morning, either next morning or next evening, depending on how quickly she'd like to get the peel over with, she can use the third peel pad and do the same thing. So post-peel, she's just gonna use sunblock. This is actually the little kit we send her home with right here.
Oh, very nice.
Yep. And so we'll have directions in it in case she forgets what we tell her to do. It's got sunblock, it's got a post-peel protectant, anti-itch cream, which contains the hydrocortisone, which also helps with inflammation, and the peel pads.
So that's nice. So you get the peel, you have your home care for the 7 days, so everything is taken care of for you all in one.
Exactly.
Excellent.
Yep.
All right, should we get to it?
We're going to get to it. So I'm going to start with the pre-cleanser, because our friend Jenny wears a full coverage foundation. So I kind of suggest to everybody who wears a full coverage foundation to do a double cleanse. To start with a pre-cleanser, a pre-cleansing oil, just trying to break down that makeup.
So that's interesting because a lot of people probably think that when you put oil on your face, it encourages a lot of oil on your face. So
yeah, it actually doesn't. It actually breaks down the oil because oil removes the oil. It cuts the oil. So by doing that, if you're congested, if you're a little bit oily, like me personally, I ran out of my cleansing oil and I'm starting to already notice a little bit of congestion in my skin.
Oh, interesting.
So it definitely does help, and I do wear makeup every single day. So I do use the pre-cleanser, the oil pre-cleanser previously, and then I use my cleanser that's good for my skin type after. And your regular cleanser will just kind of sweep away any oil residues.
Nice.
Yeah.
That's interesting. I do you feel, Jenny?
I feel lovely.
Nice.
We're gonna
It's nice
take
to have
off
someone
Jenny's
else
eyebrows.
washing my face. I've never had a peel.
No?
No.
It's a good one to start with.
It
It's
sure
definitely.
is, yeah.
It's a good one for results, do you think, Kelly?
I do. I think it's great results. Even one peel, you'll notice results for sure, especially if you have like normal skin with just like some large pores, a little bit of unevenness. The Purify Peel is great for acne. If it's done in series, it will really bring down that inflammation on the acne and help clear that acne away.
Nice.
Yeah, I personally like the Purify one for my skin because I am an acne girl. I tend to get awful cystic acne, so I like to do them every now and then if I start getting some breakouts, and it kind of gives me a little bit of a jump start. So
Nice.
including, with home skincare, it really does help.
Awesome.
So this is an LHA cleanser, SkinCeuticals, just to kind of really give her a good deep cleanse, because the more clean we get her skin, we get the oils off, we'll get a better even peel.
Nice. So with the pre-cleanser, is it for all skin types?
It is, yeah, absolutely.
So
Any skin type can
oily,
use it.
dry.
Oily, dry, acne, everybody can use it.
Nice.
How often will I do this after I do this one? Like, or does it not matter?
Your peel? You can do it within 10 days.
Oh, like do another one in 10
Yeah.
days?
As long as your skin's resolved, you can do it within 10 days.
Oh.
You just can't do it more
Seems-
than, I
I
think.
wouldn't have guessed that.
What would you,
You can't-
What's the
recommend
right-
for her?
I would recommend that Jenny she does actually have a little bit of pigment under her eye here. So she could do this one, and then after she could do a precision peel in maybe 2 weeks or so if she wants to, or after the holidays,
Mhm.
And that would definitely help with that pigment.
Nice.
And I can't get this open. Got it. So this is a peel pad, pre-prep peel pad. Basically, this is just going to clean up any more residue off her face. I really think it's just kind of alcohol, but just to clean off any cleansers that are left behind.
Get that face squeaky clean.
Squeaky clean, you got it, because the squeakier clean, the better peel we get. So we're actually going to, with this peel, you can get pretty close to the eye. You can do the brow bone, the orbital bone. So we're going to do that for Jenny because she said she was concerned with a little spot right there on her face. So we'll get it pretty close.
Very nice.
Can you do this on sensitive skin?
I wouldn't suggest sensitive skin. For sensitive skin, I would probably suggest one of the lighter Environ peels, in a series. Something like this for sensitive skin, especially somebody who hasn't been using retinol and isn't conditioned to using retinoic acids, might not have the best results for sure.
I don't use retinol, but if I did, I'd have to stop using it. How many days prior to this?
You'd want to start using it. They say 5 days. I like to say a week just to be on the safe side.
And then resume it, same thing, a week later?
Yep.
Or
Yeah, once you're downtime, once you're all healed, you're not flaking, you can start using your regular actives right over again. Alright, so this peel is actually a little different than other peels, some peels, medium depth peels, are very uncomfortable. This contains phenol, which is a numbing agent. So the first swipe on Jenny's face is going to be a light swipe. We're just going to apply the product and kind of numb the whole area for her, okay? So really light, we're just going to go over her whole face. Right up through the hairline is fine. Over her brow bone. Make sure not to press because we don't want to get it in Jenny's eyes. You can get really close to the eye.
Would you say this is one of the most popular peels that you do?
It's one of my favorite peels. Yeah, I think so.
How you feeling, Jenny?
it's stingy.
It's a little stingy, right? But then you're gonna get numb. It's a little smelly, this peel. That's the only thing really that's kind of, it's a little smelly.
I like the smell.
Generally,
It smells medical.
yeah, it does.
How you feel, Jenny? Okay. All right, so that's the first pass. You starting to feel a little bit numb.
Yeah, it's like a tingly feeling. I can't tell if it's numbness or.
Now what I'm going to do before I do the second one, I'm just going to put a little Hydro Balm in the corners of your mouth, just so you don't get that peely kind of corner of your mouth thing going on. So we're just going to apply a tiny bit over here, just as a barrier cream, and then a little bit over here, okay? And we're going to do our second pass. With the second pass, we kind of rub a little bit harder, a little more aggressive to drive the product into the skin. With Jenny, I'm not going to do too much. Basically, the end point is like a light frosting, even redness all over the skin. Jenny doesn't typically use retinols on a regular basis, so I don't want to be too aggressive with her, as her skin isn't super prepped for it.
Sure.
And she's got stuff going on soon, so.
Makes sense.
Yeah.
Want to go easy on Jenny for her first peel.
That's right.
Scare me, ladies.
Her skin already looks better.
And you can kind of see a little bit of frosting on her skin.
Yeah.
Yeah. So that's good. Nice even frosting. And I'm rubbing, but not as aggressively as I would with somebody who's been using retinol for a while and could tolerate this better. I might even do on somebody a third pass, someone who could tolerate it. For her, we'll just do 2 today.
So this is kind of debunking the whole Samantha Sex and the City chemical peel myth that people have, right?
Right.
It doesn't have to be like...
As hysterical
Yeah,
as
the
that was.
ones that she did, it was like I don't know, that was tragic. That's something like a dermatologist do, and there's so much downtime with that.
Right.
And it's painful. This she
That
won't
was
be.
so funny.
It's so funny.
With the veil and the whole thing.
Yeah.
Just so funny.
Jenny should not be in any pain or anything after this. She might be a little sensitive, a little dry, a little itchy, but there doesn't really have to be a lot of wound care. You know, she just
Yeah.
really has to treat her skin gently. You know, how do you feel, Jenny?